Does it just... Okay, so here we're looking at an anterior view of a hip joint. And what we've got is the ASIS up here and the greater trochanter out here. Here we've got the iliofemoral ligament. There are two parts that used to be called the Y ligament. You can see that all those parts, both those parts are attaching here to the ilium. Inferior to that, we have the pubofemoral ligament, and again you can see the fibres coming up to the pubis. And on the posterior aspect, we have the ischiofemoral ligament, and again you can see those fibres coming from the femur over to the posterior part of the body of the ischium. So ischiofemoral here. Now from here we can also see these fibres here, which are going around the neck of the femur, and if we follow them around we can also see them here in between the two parts of the iliofemoral ligament, and then in between the iliofemoral and pubofemoral we can just see them in there. Those fibres that go around the neck are of course the orbicular zone. So those are the orbicular zone fibres there. And then of course around the outside, around the lip of the acetabulum, we have the acetabular labrum. And we can follow that around, but inferior, on the inferior aspect, that space where the acetabular notch would be is filled in by the transverse acetabular ligament. And then if we look at this little window that's been cut here into the bone, we can see the ligament of the head of the femur, and on one of the specimens you can actually see that too. So make sure you look for that today as well. And then if we just grab another model quickly that we looked at previously, if we look at the acetabulum, so we're looking now at a left hip from a lateral point of view, we can see the nice blue lunate surface here, the acetabular fossa in the middle of the acetabulum. At the bottom we can see the transverse acetabular ligament that's filling up most of that acetabular notch, so there's still a little space there. So that's the transverse acetabular ligament, and then just inferior to that, that's the obturator membrane. So that obturator membrane filling in the obturator foramen there. You can see the obturator groove just at the top.